Mixing herbal remedies with prescription medications is a hidden but significant risk in modern healthcare. Many people assume that because herbs are natural, they are harmless, but the reality is that herbal compounds are biologically active substances capable of interacting with medications in ways that can be dangerous, even life-threatening. Unlike prescription drugs, which undergo rigorous testing for interactions and dosage safety, most herbal remedies are sold without pre-market approval or standardized dosing, leaving consumers vulnerable to unanticipated effects. The combination of herbs and modern medicine can disrupt pharmacokinetics, alter drug metabolism, and amplify or diminish drug effects, making disclosure to healthcare providers essential. One of the most well-documented risks involves St. John's wort, an herb commonly used for mild depression or mood support. St. John's wort induces liver enzymes, particularly CYP3A4, and intestinal transport proteins that metabolize many medications. As a result, it can dramatically reduce the effectiveness of drugs such as anticoagulants, birth control pills, certain antidepressants, immunosuppressants, and chemotherapy agents. For example, patients taking warfarin may experience subtherapeutic blood-thinning effects, increasing the risk of dangerous blood clots. Similarly, women relying on oral contraceptives may face unintended pregnancy due to accelerated hormone metabolism. These interactions can be subtle at first, making them easy to overlook, but their consequences can be severe or irreversible. Ginkgo biloba, another popular herbal supplement, poses particular dangers for individuals on blood-thinning medications like warfarin, aspirin, or clopidogrel. Ginkgo can increase bleeding risk by inhibiting platelet aggregation, leading to bruising, nosebleeds, or even hemorrhagic stroke in extreme cases. Surgical patients who fail to disclose ginkgo use are at especially high risk, as it can complicate anesthesia and post-operative recovery. Similarly, garlic, often promoted for cardiovascular health, can enhance anticoagulant effects, creating a compounded risk of bleeding when combined with prescription medications. Kava, used for anxiety or relaxation, demonstrates the potential for organ toxicity when combined with modern medicine. Kava can exacerbate liver stress, particularly in individuals taking hepatically metabolized drugs, such as certain antidepressants or anticonvulsants. Reports of severe liver injury, including acute liver failure requiring transplantation, have been linked to kava in susceptible individuals. Combining kava with prescription medications without medical supervision significantly increases these risks. Other interactions are less obvious, but equally dangerous. Valerian, often taken for sleep, can potentiate the sedative effects of prescription medications like benzodiazepines or opioids, leading to excessive drowsiness, respiratory depression, or impaired coordination. St. John's wort or green tea extract can interfere with chemotherapy metabolism, potentially reducing drug efficacy and compromising cancer treatment outcomes. Even herbal teas or over-the-counter supplements marketed as detox or immune boosters may contain compounds that alter liver enzymes, impacting medication levels in unpredictable ways. The core problem is that many patients do not disclose herbal supplement use to their healthcare providers. Surveys suggest that a significant proportion of adults taking prescription medications also use herbal remedies, yet fail to mention them during doctor visits, often due to the belief that natural products are inherently safe. This lack of transparency can leave clinicians unaware of potential interactions, making routine prescriptions more dangerous. In hospital or surgical settings, undisclosed herbal use can lead to anesthesia complications, abnormal bleeding, or post-operative organ strain, emphasizing the critical need for full disclosure. Medical professionals rely on accurate, comprehensive information to adjust drug dosing, anticipate interactions, and prevent adverse events. Patients should maintain a detailed list of all herbal products, supplements, and over-the-counter remedies they use, including brand, dosage, and frequency, and share this with every healthcare provider they encounter. Pharmacists, physicians, and dietitians can then evaluate risks, monitor lab values, or recommend safer alternatives. Even minor adjustments, such as temporarily discontinuing certain herbs before surgery, can prevent severe complications. Ultimately, the dangers of mixing herbal remedies with modern medicine highlight the importance of awareness, caution, and full medical disclosure. Herbs like St. John's wort, ginkgo, kava, garlic, and valerian are far from benign. They have potent biological effects that can alter drug metabolism, amplify toxicity, or undermine treatment. Without professional guidance, combining herbal supplements with prescription medications is a gamble that can jeopardize health, exacerbate chronic conditions, or create acute medical emergencies. The lesson is clear: natural does not equal safe, and transparency with healthcare providers is essential to prevent preventable harm.